Thank you all for being here today. This last week has been a very unique one for the state of Texas since the diagnosis of Ebola in a West African man visiting Dallas. State officials have worked closely with local and federal officials to protect the people of Texas. Over the past several days, we have learned a lot about the unique challenges of situations like this, and it's important that we continue to adapt our responses to these realities. To that end, today I issued an executive order creating the Texas Task Force on Infectious Disease Preparedness and Response, a team charged with studying and improving our existing plans to enhance our ability to quickly and effectively halt the spread of emerging infectious diseases of all types. This task force is made up of physicians, of academics, including some of the most accomplished experts in the field of infectious disease control and medical incident management that the country has to offer. They'll be joined by skilled leaders from state agencies that will directly be involved in any response, officials already fully versed in how Texas manages a crisis, including Emergency Management Division Chief Nim Kidd. I want to mention two people who are not here who are part of this team that are not with us today. Dr. Vicki Sutton is out of the country presently. And of course, Dr. David Lakey. David is in Dallas monitoring the developments firsthand there. This team will develop a comprehensive long-term plan to ensure that Texas deals effectively with any potential outbreak. This plan, building on our existing state emergency management plan, will cover all phases of a response, from establishment of a command and control center, that type of a structure, to coordinating with media to ensure that the people of Texas get timely, accurate, and useful information from expert sources. The exceptional knowledge and experience that has been assembled on this team will streamline our response effort, help us foresee issues before they arise, and to help local and state health officials move more quickly to address them. And it's not just about Texas either. One of our goals in assembling this task force is to reach out beyond Texas, sharing our knowledge and experience with those in other states. Incidents like this are certainly not limited to just Texas. And unfortunately, they will likely happen elsewhere sooner or later. There's only so much that a state can do, however, and many of the circumstances that led to this situation can only be addressed at the federal level, where we appreciate and we applaud the assistance we've received from the Centers for Disease Control and other federal agencies we've worked with. Washington needs to take immediate steps to minimize the dangers of Ebola and other infectious diseases. To begin with, Customs officials and Border Patrol agents at all points of entry should immediately be directed to conduct enhanced screening procedures, obtaining more information about people who are coming from affected areas, taking appropriate steps upon arrival. Those steps may be something as simple as taking their temperature. These much-needed screening procedures will also necessitate fully staffed, prepared quarantine stations wherever people are entering the country, ready to care for anyone whose screening turns up a concern, helping to prevent contagions from entering this country. Until then, however, Texas will take what measures we can, and through the work of this important task force, we'll have a stronger plan for how to do just that. To head up this team, I'm appointing Dr. Brett Giroir as director of the task force. Dr. Giroir is Chief Executive Officer of the Texas A&M Health Science Center. He is an accomplished critical care physician scientist who specializes in infectious diseases. He's also served as the Director of Defense Sciences Office at DARPA. That's the federal agency that is tasked with developing new technologies for national defense. He oversaw numerous projects addressing a wide range of subjects, including biodefense. At every step of his career, he has demonstrated profound knowledge and exceptional leadership. At this time, I'd like to ask Dr. Giroir to say a few words, followed by Dr. Charles Shortner.
Thank you, Governor Perry. This morning, I first want to say that all of our thoughts and prayers are with the patient and his family, all those who are potentially exposed, who are currently being monitored, and the healthcare providers who are working tirelessly to care for the hospitalized patient. We also send our support to the dedicated experts from Dallas, the state of Texas, the CDC, and other federal agencies who are leading the effort to identify, monitor potential contacts, and prevent any further spread of Ebola within Texas. Both myself and several members of this team spent the day in Dallas yesterday, and I want to assure everyone that there is a tremendously talented and expert group of professionals engaged around the clock, functioning as a single team to do what is necessary to stop any additional spread of Ebola. I especially wanted to commend the exceptional efforts of Dr. David Lakey, who is now on the ground in Dallas, our Commissioner of State Health Services. But before talking about the task force, I would like to reemphasize 2 points about the current Ebola situation. Number one, the presence of Ebola in our state is a serious concern. However, all appropriate identification and control measures have been implemented and are working to prevent any additional transmission of the disease beyond those contacts potentially already exposed and now being carefully monitored. Number two, the Ebola virus can only be spread by direct contact with blood or bodily fluids from an infected person who is actively symptomatic. It is not spread by air or water. You have no risk of contracting Ebola if you have not been in direct contact with the blood or body fluids of an infected person who is having symptoms such as fever, vomiting, or bleeding. Now let me speak about this new task force on infectious preparedness and response ordered this morning by Governor Perry, who has been highly involved on a daily basis monitoring the current Ebola case and assuring that the teams on the ground have all the necessary resources at their disposal. Infectious disease outbreaks are real, they are inevitable, and even more likely given our interconnected world, where an outbreak anywhere is a risk everywhere. Therefore, we must be fully prepared as a state to address this challenge. Governor Perry is mobilizing the tremendous wealth of expertise within the state to assure that we are as prepared as possible for any further Ebola cases, both in the near or long term, as well as other public health threats that will inevitably occur. The specific objectives of the task force are three: to provide expert assessment and recommendations related to the current Ebola response and serve as a resource for the state and local levels of government. Remember, this is the first Ebola patient diagnosed in the United States, and it would be foolish to believe that there would be no lessons learned. If there is room for improvement, we want to assure that Texas learns, we document, and Texas implements solutions. The second mission is to develop a comprehensive plan to ensure that Texas is prepared for the potential of an even more widespread outbreak of an infectious disease and can rapidly respond in a way that effectively protects citizens. And finally, the task force can serve as a reliable and transparent source of information and education, both for Texas leadership and for Texas citizens. The members of this task force are here to serve the people of Texas. We're here for no other reason. We have already identified several areas to focus on, and I wanted to give you a couple of examples of the many so that you have a little bit more concrete idea. The first is hospital preparedness. A key step in controlling an Ebola or similar disease is the identification of and medical isolation of the patient. The committee will rapidly undergo a procedure to assess and make recommendations about the preparedness of the state to achieve this task with high probability while not crippling health care for the daily population of patients who need care. Another example is decontamination and waste disposal. This is a very complex issue that involves not only scientific best practices, but also complex transporting, permitting, federal regulations, containment, and logistical issues. The final example relates to the care of patients undergoing monitoring or controlled monitoring. These are not just contacts. These are human beings who need food, clothing, sometimes even shelter. They may need social services and counseling. And we have realized very quickly that individuals involved are as diverse as the population in Texas, and that cultural competency will be a critical factor in effective communication and collaboration. Before I turn this over to Senator Schwertner, I just wanted to briefly introduce the members of the task force, again, all but whom are here, but two of whom are here today. And maybe you can just step forward when I introduce you. Dr. Gerald Parker, Vice President of Public Health Preparedness and Response at the Texas A&M Health Science Center, and formerly the Deputy Assistant Secretary of U.S. Health and Human Services, a key personal leader in the H1N1 pandemic. He will also be Deputy Director of the task force. Dr. Tammy Beckham, Director of the Veterinary Medical Diagnostic Laboratory and Institute for Infectious Animal Diseases at Texas A&M. Dr. Peter Hotez, Founding Dean of the National School of Tropical Medicine, the Baylor College of Medicine, and President of the Sabin Vaccine Institute. Mr. Richard Hyde, Executive Director, Texas Commission on Environmental Quality. Mr. Tim Irvin, Executive Director, Texas Department of Housing and Community Affairs. Dr. Kyle Janik, who has been an amazing resource for the current Ebola patient and situation. Executive Commissioner, Texas Health and Human Services Commission. Neam Kidd, Division Chief, Texas Division of Emergency Management. Dr. Time Kizak, virologist and an expert in boots-on-the-ground field epidemiology and ecology of hemorrhagic fevers such as Ebola from the University of Texas Medical Branch at Galveston. Dr. David Lakey, as you know, who is on the ground in Dallas, Commissioner of the Texas Department of State Health Services. Dr. James DeLuke, Director of the Galveston National Laboratory and Professor of Microbiology and Immunology, Director of the Program of Global Health, again at UTMB. Dr. Scott Lillibridge, Professor of Epidemiology and Assistant Dean, the A&M School of Public Health. Scott was also the founding director of the CDC Bioterrorism Branch and has profound experience in incident management and investigations. Colonel Steve McGraw, Executive Director, Texas Department of Public Safety. Major General John Nichols, Adjutant General, Texas National Guard. Dr. Victoria Sutton, who is making her way back from overseas after the call, who is the Professor and Director of the Center for Biodefense Law and Public Policy at Texas Tech University School of Law. Lieutenant General Joseph Weber, Executive Director, Texas Department of Transportation, and Mr. Michael Williams, Commissioner of the Texas Education Agency. Preparedness requires clear, decisive, and prospective management aimed at rapid response and long-term solutions. I am honored to be joined by such an incomparable group of professionals who are each committed to ensuring Texas is fully prepared. And now I'd like to introduce Dr. Schwertner, Senator Schwertner, who is chairman of the Senate Committee on Health and Human Services.
Good morning, and thank you, Governor Perry. And thank you for the decisive leadership you've shown in appointing this special task force to highlight the ongoing danger of infectious disease and to help coordinate our state's unified public health response. Governor, many of our citizens have expressed understandable fear and confusion regarding the recent case of Ebola in Dallas. As public officials, we have a clear duty to provide a greater level of education about this disease, as well as to provide Texans with the assurance that their lives and the lives of their family members are safe and protected. Unfortunately, recent events illustrate that we, as a nation, as a state, and as individual counties, can clearly do a better job. As chairman of the Senate Health and Human Services Committee, I look forward to working with this task force to improve all aspects of our public health response to infectious diseases, from our organizational and command structure to the protocols and procedures followed by hospitals and other healthcare providers, and finally, to the appropriate coordination between federal, state, and local authorities. Thank you, Governor.
Doctor, thank you. Governor, thank you for being with us today.